So we're going to talk about the non-contractile properties of the ankle. So we'll start off with the bones, then joints, then the ligaments. So we've got with tibia, we've got with fibula, and on the tibia we've got the medial malleolus, the fibula we've got the lateral malleolus. Then we've got a few tarsal bones here, and we've got the calcaneus. So in the calcaneus we've got a few bony prominences. So where this red mark is here, this is the peroneal trochlear. And we've got this what it does, it separates the peroneus brevis and longus, them two tendons. Then we've got the peroneus, then we've got the calcaneus tuberosity, which is this area here. Then if we flip that inferiorly, we've got the medial process of it and the lateral process. Then we've got the notch in between. Then if we just keep moving forward to it, we've got the calcaneal tubercle, which is this area here. And then also we've got the succinecrum tali, which is here. Then we've got the posterior process of the talus. We've got the lateral process and the lateral tuberosity, the medial tuberosity. Then we've got this little groove here, which comes from the posterior process. It comes down underneath the succinecrum tali, and this groove is called the flexor hallucis longus groove, and that's that. Then we move on to the talus, which is this bone here. On the talus, we've got the head of talus, the neck of talus, and the body of talus. And I think I've mentioned everything on the talus there. Yep. Then we've got the navicula, which is here. Then we've got the navicular tuberosity, which is there. Then we've got the three cuneiforms. We've got the medial cuneiform, intermediate cuneiform, and the lateral cuneiform. Then we've got the cuboid, which is here. Then we've got the cuboid tuberosity, which is there also. Then we've got the metatarsals, and then we've got the proximal, intermediate, and distal phalanges. So that's the bony landmarks. Now we'll move on to the joints. So we've got the tibia talus joint, which is otherwise known as the ankle joint. This allows dorsiflexion and plantar flexion, and that's a synovial hinge joint. Then we've got the calcaneal cuboid joint, which is the articulate between this and the cuboid, and that's a synovial gliding joint. Then we've got the subtalar joint, which is the inferior part of the talus and the superior part of the calcaneus, and this is again a synovial hinge joint. What else have we got? We've got the talocalcaneonavicular joint, and that's the ball and socket joint, synovial ball and socket joint. Then we've got the tarsal metatarsal joints, which again synovial gliding joint. Then we've got the tarsal metatarsal interphalangeal joints, which are ellipsoid joints allowing extension, flexion, adduction, abduction, and circumduction. Then we've got the proximal and distal interphalangeal joints, which are hinge joints, which allows flexion and extension. So that's the joints of the ankle. Now we'll move on to the ligaments. We'll quickly talk about some retinaculums. We've got extensor retinaculums, which is got here, superior, inferior, and lateral inferior, and they keep the dorsiflexor tendons in place. Then we've got the flexor retinaculum, which comes from here to here, and they keep the plantar flexor tendons in place. That's the retinaculums. Now we'll go on to the plantar fascia. The plantar fascia comes from the calcaneus tuberosity and comes into the first, second, third, fourth digit of the foot. And that's made up of a few ligaments. We've got the calcaneal cuboid ligament, we've got the long plantar ligament, and obviously the plantar aponeurosis, and that's the plantar fascia. We'll talk about now the deltoid ligament, which originates from the medial malleolus, and it's made of four ligaments. We've got the anterior tibiotalus ligament, the posterior tibiotalus ligament, and we've got the tibial calcaneal ligament, and then we've got the tibular navicular ligament. And then we've got the lateral ligament complex, which is made of three ligaments. We've got the anterior talus fibular ligament, which is here. Then we've got the calcaneal fibular ligament, which is there. And then we've got the posterior tibular fibular ligament, which is there. And that's all that.